Hello, my name is Dr. Thomas Einhorn, and I am Professor of Orthopedic Surgery at New York University. I'm also formerly the Chairman of Orthopedic Surgery at Boston University School of Medicine. Today I want to talk to you about the economic impacts of the COVID-19 crisis in the orthopedic area. Coronavirus 2019, known as COVID-19, is the virus now synonymous with the sudden respiratory failure and social distancing. It was first identified in Wuhan, China in December 2019 and spread globally, resulting in an ongoing pandemic with more than 1 million confirmed cases worldwide. The pandemic has challenged healthcare organizations on many fronts. Without federal and state relief, the moratorium on elective procedures will further increase the financial burdens already encumbering many lesser-resourced healthcare organizations. 22 hospitals and healthcare systems filed for bankruptcy in 2019, and this number will only increase in 2020. Elective procedures account for 48% of hospital costs and potentially even larger percentage of revenue. 5 musculoskeletal procedures, total hip replacement, total knee replacement, discectomy, spinal fusion, and treatment of lower extremity fractures account for 17% of all operating room procedures in the U.S. hospitals. Without elective orthopedic procedures, most healthcare systems would be insolvent. The current pandemic has thrust the healthcare system into uncharted territory. With healthcare making up 18% of gross domestic product, the elimination of roughly 50% of hospital revenue, and the destruction of approximately 3 months of elective surgical practice will cripple financially both lesser-resourced institutions and the employees of private practices. This will further accelerate the unemployment problem, compounding the adverse effects on the U.S. economy. In response to this crisis, the federal government passed the Coronavirus Aid, Relief, and Economic Security Act, known as CARES. This is a $3 trillion relief fund strategically aiding individuals, businesses, and state and local governments while maintaining public services. The bill designates $100 billion to hospitals. This $100 billion will be allotted by the Secretary of Health and Human Services, who is commissioned with both quickly overseeing its distribution and ensuring that healthcare organizations benefit. In addition, the CARES Act has designated an additional $350 billion to small businesses, which include private orthopedic practices. Notably, the PPP can be combined with other small business programs, including the economic injury disaster loans. However, these programs have funding caps and are currently being dispensed on a rolling basis. Together, we are in the midst of a healthcare crisis which presents unique challenges for all Americans. Orthopedic surgeons have done their part in drastically reducing non-urgent surgical case volumes with the goal of minimizing exposure and preserving PPEs. The program and relief funds instituted should ease the economic burden. However, it is imperative that orthopedic surgeons take an active role. When the time comes, we are emerging from the peak of the surge in COVID-19 cases. Great care will be needed to uniformly enforce how we proceed. A second outbreak in the autumn of North America also needs to be considered. A test for immunity would go a long way towards accelerating our ability to go back to a more normal healthcare reality. A national policy to regulate the reopening of surgical elective procedures would help. Thank you.